CEO and co-founder. A couple quick headlines before we jump into things with Dr. Michael Fine. First, Governor Baker of Massachusetts has announced he is not running for re-election. I think sending a little political shockwaves both through New England as well as the country. He's one of sort of those last moderate Republican leaders in the country, and he is bowing out. But let's go to Dr. Michael Fine. He's the former director of health. Dr. Fine, numbers are up in Rhode Island. They're up significantly. We're seeing upward trending in transmission rate, in number of new cases, in hospitalizations, in the number of deaths. What does all this mean, and where are we headed?
We are headed up. We are sort of seeing more disease and lots more disease, and I can't tell how high and far it's going to go. We know, I think the projections now are that we ought to be expecting 800 new cases a day, starting basically now for the next 3 or 4 weeks at least. And the question is, like, does that keep going? And does it go higher? Does it stay about there? That's determined only by what we choose to do. The extent to which we're masking indoors, the extent to which we're staying home. If we're not doing those things, regardless what government is telling us, if we don't do those things, these numbers will go up and up. And when the number of cases goes up, 3 to 4 weeks later, the number of hospitalizations go up and the number of deaths go up. So I am expecting that we're going to have a pretty rough to very rough December and January, and perhaps into February.
Dr. Fine, let's just break down some of these numbers. New York Times has Rhode Island tied with Connecticut, that over the past 14 days, we have the highest percentage increase in new cases. Yesterday was over 700 new cases. Maybe more concerning is that the transmission rate continues to go upward, and that the hospitalizations are going upward, up about 30–40% in the past 2 weeks. Are we headed towards months like we had last winter?
Well, I think we're headed toward months like we had last winter in terms of number of cases. Hopefully the number of deaths will be 20 or 30% of where we were last year. Hopefully we won't see more than, it's amazing to hear, for me to listen to myself say this, but hopefully we won't have more than 8 or 10 deaths a day at its height instead of 20. And it breaks my heart to say this, Josh, but that's exactly where we're going, and we're in a more dangerous place than Connecticut is because our baseline was higher. We started at a much higher level of transmission than Connecticut did, and we're going up and going up just as fast as the fastest rising state in the country.
Yeah, let's talk about deaths a little bit. From running a news organization, it's heartbreaking to see I can say no different than pathetic comments posted in social media about deaths. Everyone only seems to be concerned with ensuring that there's no restrictions on their individual rights. But we're talking about, in the past week, 17 deaths related to COVID. And the comments are so beyond cruel. Oh, they must have been old, they must have been sick. Well, yes, some were old and some might have been sick, but they weren't all, that's clear. We've seen firefighters, healthy 50-year-olds. We've seen police officers, healthy, pass
School
away.
principals.
I'm sorry?
School principals.
Yeah, we've seen school principals. It's just the lack of compassion about families losing their loved ones over the holiday. Listen, those 17 families who lost their loved ones over this past week, they're never going to think of Thanksgiving the same way. It's never going to be that holiday of joy. It's going to be that holiday of death. Your thoughts? Have you ever seen this as a public health expert?
I have not, and actually I was starting to sense it when I was in state government, and it frightened me because it's not only bad for public health, it's bad for the democracy. Once we start cheapening life, once we start saying somebody's death doesn't matter, then we can find ourselves in a period of political violence that can spiral out of control in a second because violence will become a way to solve social problems.
It's so anti sort of American values too. You know, I mean, the United States Marines have always said we leave no one behind. We're now at a point in Rhode Island of we leave everyone behind.
Yeah, well, I mean, that started with the opioid overdose epidemic, which is now out of control. It's proceeded here. The question is, when does it stop? When do people get to the notion, the famous notion that, well, they came for the Jews and I wasn't a Jew, so I didn't matter. And, then they came for the Catholics and I wasn't a Catholic, so I didn't think it mattered until they came for me. That's kind of where we're on this very slippery slope. And people just need to think about what it's like for somebody else, because guess what? One of these days, you're going to become somebody else, and then you'll wonder where the help is coming from.
Yeah, Dr. Fine, let's focus a minute on what we know about the Omicron variant. It sort of busted loose late last week. There's no hard data, but there's lots of information. And I'm going to recap what I think we know to date. We know that it appears to be substantially more contagious than the Delta virus. The Delta virus was about 70% more contagious than the Alpha, the Wuhan original version of COVID. This may be as much as 500% more contagious. That's one. Number two is interviews with physicians who are on the front line and who de facto uncovered this new variant from South Africa are saying it appears to be more mild than the Delta variant, and that while it is requiring hospitalizations in certain cases, does not appear to be as deadly. Is that the correct recap of kind of what we know after about a week?
Yeah, I wouldn't even say we know that much. I mean, all this is anecdotal stuff at this point. We don't have good science. The one thing we know is that in South Africa, all of a sudden, basically 100% of cases are Omicron instead of Delta. So it has basically replaced Delta inside of a month. The first reported case, I believe, was identified on November 9th. So we've actually had, almost a month of experience in tiny ways. We don't know enough about virulence, about the extent to which it's dangerous. I have this great hope that if it's more transmissible, it will be less virulent. And if that's the case, that actually may turn out to be a good thing. That's a whole nother story. But we just don't have any good science yet. And I think it's way too early to draw conclusions or make predictions till we have that good science.
The CEO of Moderna said, don't hold me to it, late yesterday or early this morning, I can't remember which piece was reading about it, and said he thought that his highly successful vaccine was going to be less effective against Omicron versus the Delta variant. I'm sure they are working around the clock at places like Moderna and Pfizer, looking at the genome series and trying to break down and identify the complexity of this new variant. Your thoughts on how the vaccines may or may not work and what the implications of that is?
Well, I just think we need to wait for the science. I mean, I think we ought to be very careful about sort of creating science out of press releases and out of the comments of people who have something to sell. Remember, like in a certain way, Moderna wants their vaccine not to work as well, because that gives them the opportunity to develop a whole new booster and sell a lot more vaccines. That's not to say that's what their motivation is, but I still think you gotta sort of take it all with a grain of salt and wait for the science. Let's get the science and know what we're doing instead of guessing. And let's not either over frighten or over promise until we have that science under our belts.
Okay, let's shift over to vaccines in general and how we think about vaccines. Nick Landich, our colleague at GoLocal, wrote a piece about how we should start thinking about vaccinations and vaccination rates. Right now, the governor talks about 90% have gotten at least one shot. We know that approximately 70%, 72 or 73%, have received, in the case of Moderna and Pfizer, 2 shots. In the case of Johnson & Johnson, 1 shot. But that's wildly misleading as being fully vaccinated. Do we need to change the definition? We know that both in Moderna and Pfizer's case, the effectiveness of the vaccine wanes significantly at about 6 months. South Koreans think it's at 4 months, by the way, and they're using boosters at 4 months. But let's just use the baseline of 6 months. The vast majority of Rhode Islanders who have been vaccinated were vaccinated before June 1st, and thus their protection level has waned and waned significantly, and only 156,000 Rhode Islanders have gotten a booster. Are you fully vaccinated with 2 Moderna or Pfizer shots, or should we now be thinking about it as 3 shots to be fully vaccinated?
You're fully vaccinated only when you are you've got 2 shots plus appropriate booster or boosters, because we don't know how many boosters we're going to need yet. So, after 4 to 6 months, the current recommendations are after 6 months, you need your first booster. And then, let's talk again in a few months to see whether you're going to need a second booster. Logically, one might expect that may turn out to be necessary. And it may be at 6 months, it may be a year. We need some science to help us understand that. Josh,
so if you got your first 2 shots completed in April or May of 2021, to be fully vaccinated, you need a booster now, correct?
Absolutely, absolutely. Anything before May, actually, anything
included.
Yeah, you just got to go get boosted if you get vaccinated up till the end of May at this point, because it's the beginning of December.
Yeah.
And come the 1st of January, if you were vaccinated, your second shot was in June, then you're going to need a booster then. We just got to, this is going to be a rolling thing. And it may be the case that 6 months to a year later, you may need yet one more booster. We'll see. We got to see what the science says.
And forget Johnson & Johnson. You're going to be a pin cushion by the end of this thing, because they're already talking about that you need a second and potentially a third shot after just 2 months.
Yeah. I mean, each one's going to have its own little thing to it. We've got some evidence that says getting boosted with somebody else's vaccine is probably a good idea for most of the vaccines. But, the most important thing is that you have had enough boosting so that you can prevent hospitalization and death, particularly, if you are, as you get a little older, understanding that it doesn't look like the vaccines are terribly effective in people over 80. So people over 80 not only should be vaccinated, but should be exceptionally careful about their contact with others when we have high levels of community transmission. I don't think people over 80 should be shopping right now, and certainly masking whenever they go out.
Government, not only in Rhode Island, but pretty much across the country, is not putting in any limitations. They're not mandating masking. They're not limiting store hours or any of the other elements that we saw last year. What's the implication of 0 new regulations or policies for combating this uptick?
More hospitalizations and more deaths and more infections. I mean, we've learned something in the last week or two. We've learned that the vaccine is great at preventing hospitalizations and deaths, but it doesn't prevent infection. And because infection can spread to vaccinated people as well as unvaccinated. And because infection can be spread by vaccinated people as well as unvaccinated people, we have to totally change our game if we're going to reduce community spread and protect the people who are most vulnerable. We just have to rethink what we've done, how we've thought about it so far.
So let's clarify something, and I need your help. Because the backlash is when we put out a statistic like Nick wrote about, I think, late last week, which is almost everyone who died in the preceding week had been fully vaccinated. How is the vaccine protecting people from death, but the reality is that the majority of people who are dying now in Rhode Island were fully vaccinated?
Well, it's a little complicated. One is the bulk of those people were over 80. And the thing to remind people is that people over 80 are not well protected against hospitalization and death by the vaccine. But people who are under 80 are well protected by the vaccine. And it's those people who can rely on the vaccine to protect them from hospitalization and death. But people over 80 should not rely on the vaccine alone to protect them from hospitalization and death. We've got to get this messaging clear because I don't think anybody much understands it.
Yeah, and also that the number of those over 80, more would die if there wasn't a vaccine.
More would die of people over 80 by far, and more under 80 would die by far and be hospitalized. The vaccine is doing a phenomenal job, at what it was, at what it was developed to do, but it isn't perfect. And we have to understand the places where it needs a little help. And the place it needs most help is reducing the level of community transmission, because that's what puts everybody at risk for infection. It's not whether you're vaccinated or not, it's what the level of community transmission is. And right now, the level of community transmission in Rhode Island is very high, and it's growing fast.
Okay, I'm an average family. What should I be doing? Can I go to dinner in a restaurant? Can I go to the theater? What precautions should I be taking?
Well, it depends on the age of the people in your average family. But, if you've got two adults in their 30s and 40s and a couple of young kids, I think it's reasonable to be out and about. It's better for us vis-a-vis community transmission for you to take food out and eat it at home. But if you really want to go out, it's not at any particular risk to you and your kids. If you're elderly, if your family is an elderly family, then, I just stay home and I wouldn't be shopping. And for everybody, I think everybody needs to be masked when they're in any kind of inside environment that's not their homes, starting now for the next 2 or 3 months, every single time they can.
Okay, Dr. Michael Fine, what should we be looking for? We see a transmission rate in the mid 300s. That's, our action level in Rhode Island is 100 cases per 100 cases per 100,000 over a 7-day period. We're running at 340, I think, right now, 350. That's one. Hospitalizations jumped up over the past 2 weeks. Cases have increased over the past 2 weeks by 44%. Cases are up. What's going to happen? What should people be looking at over the next 7 days?
Well, I think what we're going to be looking at is further climb. I think we'll see transmission go to 375 or 400. I think we'll start to see 800 cases every single day. We'll start to see 175 to 200 people in the hospital. The hospitals are going to start to fill a little bit. I think they can manage it, but they're going to be stressed. And the thing that we really need to watch out for is the way this impacts our healthcare workers, who are likely to start to get tired and need all the help and support they can get. You remember when healthcare workers used to leave the hospitals and people would come out and applaud at 7 o'clock. Man, that needs to start again now, because those guys, the guys on the front lines who are doing all this hard work, with no support from their larger community because we let this community transmission happen. We need to support our healthcare workers like nothing else.
Dr. Michael Fine, as always, thank you very much. For everybody else, stay tuned. A lot is going on across the board. We'll have it fast, and we'll have it out to you via the e-blast. If you haven't signed up, top right corner on the desktop, on mobile, it's over on the left-hand side in the menu section. Sign up for the e-blast, get your news first. For everybody, stay healthy. Obviously, if you haven't gotten vaccinated, run, don't walk. I'm almost exhausted even talking about it. Maybe more important is to get boosted. If you were fully vaccinated before June 1st, you need a booster shot ASAP. Thanks, everybody. Stay healthy.
Do everything Josh said and wear a mask whenever you're outside from now until community transmission goes down, which is going to be 4 to 6 weeks at least.